All right. Hi, everyone. I'm Raquel Keene, and with me is Scott Silver, and we are health management directors at Haran. Collectively, we have over 30 years' experience in health management, helping to design wellness programs. We are kicking off a 4-part series on Wellness Wednesdays, and this week we're talking about cracking the code, how to control your healthcare costs for an organization. And we are going to bring you our best practices of years in the industry to help you and give you the recipe for success. Scott, I'm going to ask you the first question. What are the fundamental actions necessary for improving the healthcare cost trend for an organization?
That's a great question, Raquel. And there's a very fundamental requirement in order to have organizations be able to achieve a cost trend improvement on their healthcare costs. And it really and it sounds simplistic, it sounds very basic, but it really boils down to offering your employees and your spouses covered under the healthcare plan an annual opportunity to complete a blood draw so that they can become aware of their health conditions and their medical conditions and be able to then seek help from a physician in order to address those. And while that sounds very simple, if you look at the national average of organizations that have a wellness program, they're offering a blood draw, what you see is about 50% participate. And when we talk about offering that blood draw, we're talking about needing to achieve very high participation. Likewise, if you look at the number of plan participants year over year that complete a preventive exam on their own voluntarily, what you typically see is 35 to 40%. So cracking the code, being able to ensure that you're going to achieve a better trend on your healthcare costs by either flattening that cost or actually reducing that cost year over year. The work that we've been able to achieve with many of our clients who have achieved that, what it boils down to is having 90% or greater of the employees and spouses covered under the plan to be completing that annual blood draw. We used to say it was 80%. We revised those numbers upward just because of the research and the analysis we've been doing with our analytics team. And that high participation is it's extremely crucial. And the reason for that is because if you look at healthcare cost overall, what you find is about 5% of plan participants account for 50% of the cost. And so to be at 50%, most likely that 5% is not engaged, or the future 5% that are going to have high claims. And so when you get it to 90%, then you have a much higher probability of capturing some of the people that may resist, may not want to go through the process, and you engage them, and then they're going to avoid potentially a large claim that affects themselves, their family, and obviously the overall cost trend for the company. So to kind of throw another question back at you, Raquel, if you think about what will really work for organizations and being able to get 90%, maybe it'd be good for you to talk about, what kind of actions does an organization need to take to ensure that they're going to have high engagement?
90% definitely can seem intimidating, and many of our clients take different strategies to get there over time. But what we find to be most impactful in getting to 90% in your health awareness campaign is to offer an on-site biometric screening because it's easy, it's convenient, and it removes all the barriers that a client might face in terms of ensuring that employees complete that activity. While biometrics on site are important, we do have clients that do the PCP route where they drive engagement to getting an annual physical with their primary care physician. Ultimately, I think a best practice is to see both of those. We want to see employees knowing their numbers, and we also want them going to their doctor for follow-up care. In our Haranalytics data bite, we found that employees who go to their doctor save 11% on average in their claims costs. And spouses who go to get their annual physical save 21% on average. And that just speaks to the importance of early detection and prevention. So we are definitely adamant about knowing your numbers and getting employees and spouses to participate. So with that, that concludes our first series of this 4-part series on Wellness Wednesday. We hope that you've enjoyed it. Just to highlight some of the things we talked about today, participation matters, strive for 90%, make it easy, convenient for employees to participate and spouses to get their biometrics and to go get their annual physical, and keep it simple. This is a recommendation that we have seen work and that does realize a true ROI for your organization. We look forward to seeing you next Wednesday, where we will talk about outcomes-based and what is the outcome with outcomes-based wellness programs. Thanks.